Hello, Dr. Kamran. How are you today in general?
Thank you very much, Bassam. It's great to be here in studio with you. I'm doing good, thank you very much.
Doctor, a lot of audience, they want to hear about your background and why you choose neurosurgery and what is your philosophy in neurosurgery.
Well, first of all, I didn't choose to become a doctor. Actually, that choice was made for me by my mom. When I was a kid, when I was a teenager kid, I actually wanted to become a physicist. I was deeply interested in physics and mathematics, and I wanted to pursue professional career in physics. However, my family somehow, mostly my mother, convinced me to become a doctor. Years later, I chose my own specialty, neurosurgery specifically, because neurosurgery is so challenging. It is very diverse. Most people, when hear about neurosurgery, think about brain surgery and brain surgery only. However, our specialty is called neurosurgery. That means that neurosurgeons operate on any part of the nervous system, which is the brain, the spinal cord, spine, and the peripheral nerves. And since nerves are anywhere in human body, so a neurosurgeon has an ability to operate in any part of the body where the nerve are. And another reason for me choosing neurosurgery was diversity, because we have such a wide spectrum of problems that ranging from, let's say, spinal instability to parts that makes us human, parts that deal with our emotions, deals with our mind state. So, for example, we are dealing sometimes with the conditions like a depression, and now there are trials ongoing to do deep brain stimulation for depression. So if you look for the spectrum of problems that the neurosurgery is dealing with is much wider than in other specialty. And that's very challenging personally. I like challenging tasks. I always was attracted to challenging tasks. And I think that was the main reason why I chose this specialty.
Yeah, but in neurosurgeon in general, there is something, let's say, about like more specific, like the technique, the methods which you choose it for every single case. For example, we hear a lot about other procedures, and there is open surgery which you perform. So when we can choose open surgery or other type of surgery like endoscopic surgery or robotic surgery, how do you think in general about other methods, other surgeries?
Yeah, well, endoscopic surgery, robotic surgery, and the concept of MISS, which is minimally invasive spinal surgery, has become the reality over the last, I'd say, 40 years. It started with endoscope coming into neurosurgery, which started in late 90s. Then it really took up in a new millennium, and now it's a part of the routine neurosurgery. Robotic surgery, robotic methods hasn't come to neurosurgery so far. Another concept that came is minimally invasive surgery, and particularly minimally invasive spine surgery. So these are the new concepts, relatively new concept in neurosurgery. Well, here it is. In a classical surgery, in a classical neurosurgery, you have an objective. let's say you have a tumor to be removed, or let's say you have a specific pathology that needs to be addressed. And you do it. However, by doing so, you're inducing collateral damage. Collateral damage to skin, collateral damage to fascia, collateral damage to muscle, to bone, and most importantly, you may induce collateral damage to the nerves or the brain parenchyma or the spinal cord parenchyma. So, minimal invasive surgery and endoscopy is a part of the minimal invasive surgery, evolved to decrease the impact of collateral damage. So still, you should be able to execute the procedure that needs to be done. However, if you're choosing a small incision, if you're choosing a direct path to the area, and if your method does not restrict you in executing the procedure, then you should be able totally to do so with a minimally invasive option. However, if this minimally invasive option compromises your ability to execute the procedure fully, then minimally invasive surgery should not be performed. So the idea, the concept, the philosophy of MIS and MISS as a part of it is to do what needs to be done with a minimal damage to the structures nearby. If you can do it, that's great. Just go for it and do it. But there are cases when you choose to do endoscope or when you choose to do MIS, then you might not be able to execute the procedure in a way that is executed in an open way. So you don't have an access, or let's say you don't have as good as bleeding control like you would have in open surgery, then open surgery would be a better option.
Yeah, but for example, we see many cases that the patient choose minimal invasive surgery, but we see there is the damage, it's more bigger than open surgery, and we see many scars and many scars inside the surgery area. So why you think it's happen? It should, for example, it should help a neurosurgeon to avoid like damage and so on. But we see like it's still not in the level of quality which we required for a neurosurgeon.
Well, I would rather classify your question as a philosophical question, because we running into concept of appearance versus content. What is more important, appearance or the content? In neurosurgery, the content matters more. The things that you do in the surgical field matters more than your reflection to outside world. So let me elaborate this topic. So concept of minimal invasive spinal surgery, and I think that your question was mostly about the MISS, has evolved over the last 20 years. So the idea is to place hardware into spine or to execute the procedure with a smaller skin incision and a smaller muscle damage and do less collateral damage. And number of publications has evolved to support this concept. They say if you do it in an open way, you make a big long incision, you strip the muscles away from spine, and then you do bloody surgery, and recuperation time is longer. Whereas if you do it in a minimally invasive way, it takes shorter time, blood loss is less, and muscle damage is less. Well, and that's how many companies, medical device companies, picked up the idea. They produced specific tools and incorporated them into their hardware, and so it gave a birth to culture, particularly young neurosurgeons who think that MISS is an ultimate goal, all right? So, but in some sense, MISS in some cases may beat the purpose. Let me give you an example. So for example, if you're putting hardware into spine, in a regular way, you would do incision as small as possible, then strip the muscles from spine and move them apart, and then you put the hardware. You don't cut the muscles, you strip them away and then you put them back. But if you do MISS, then you should go through the muscle and you make one incision per screw, and you insert your tools and your implant through these channels. So let's say you're putting, I would say, 6 screws. So that means that you have to make 6 separate incisions to put 6 screws. And then inside the muscle, 3 on one side and 3 on the other side.
So it's considered as damage to the muscle?
Of course, it damages the muscle. But the claim is that this cumulative damage to muscle is less than the cumulative damage to the muscle that would be with an open approach. And there are a number of publications, basically they put in that showed that the amount of muscle damage is less with a MISS surgery. However, what we actually figured out that when they do it, they usually do not put the cages into the spine or put small cages or irrelevant procedures, and that does not fuse. So that's the point that I mentioned in the beginning of our discussion. So MISS, or minimally invasive surgery, is it spinal surgery or any other surgery, should not compromise the objective of the surgery. It should not compromise the primary goal of the surgery. So you should execute your surgery without any deficits. If you do it and you claimed, oh, I did, in a minimally invasive way, that basically beats the entire aim or purpose of surgery.
Yeah, but for the patient, it's more attractive. Let's say
it does attractive because this is has become, unfortunately, a marketing tool. Okay, like robotic surgery has become a marketing strategy for hospitals or healthcare providers when they say, oh, we do surgery in a robotic way or we do surgery this way. There is no question that robotic surgery and endoscopic surgery, they provide benefit in some cases, in some selected cases. But they are just tools. They are just the specific tools that should be used on specific purpose. And unfortunately, they are marketed in a way that as if they are created specifically to replace old open surgery. They are not. They have their limits. Actually, there are big problems with them in some cases when it comes to manipulation and the bleeding control. But they are being heavily marketed. The reason why, because if you're a company that making those tools, then it becomes your selling point. If you're a healthcare provider, let's say hospital, and if you purchase such equipment, then you can use it as a marketing tool to attract more patients. And that people are purposefully misled by those campaigns. unfortunately.
So we need more about like educate the patient what's the difference between both methods, let's say, and we see a lot of the same, for example, procedure which it's done by robotic or endoscopy and so on. Does it related also to the neurosurgeon who applies this technique? For example, is it need the special skills, more what you study in university, for example, to use these tools?
I do agree with the part that we need to educate patients. The doctors, mostly the healthcare providers, should give the patients the full spectrum of choices available for his or her case. Okay, including minimally invasive procedures, and he or she should provide information why the surgeon is using MISS in this case or open in that case. He should be able. Another thing is the patients as primarily beneficiaries of the treatment, they should educate themselves. And there are very good sources of information on the internet where they can search, research, and basically get necessary information to make a choice. It depends eventually to the research skills of a person. If a person has good research skills, is able to find the necessary information and make choice, that's great. However, not everybody has the same level of research skills, and in some cases this ocean of advertisement overwhelms the person, and we have seen the patients who became so attracted to the concept of minimally invasive surgery, they went and eventually had failures. Another question is about the skills and education or training. Those trainings are readily available, like endoscopic treatment and the minimally invasive treatment options are readily available for anyone who would like. By anyone, I mean surgeons, for neurosurgeons who would like to take them. Endoscopic surgery of the brain and the skull base is a part of routine neurosurgical training in many programs. Endoscopic spinal surgery also slowly but surely becoming part of the routine in many programs. So they are readily available. And I think that's a good trend, because the residents, the newly formed neurosurgeons, now they know what would be the selection criteria to execute endoscopic approach versus the open approach. They would make more conscious choice in the future.
Mm-hmm. So you talk about educate the patient about which method he should choose and so on, and you talk about part of one topic which I prepared to ask you about it, which is AI. We see a lot of patients nowadays, they come and they understand their case because they read it or they educate themselves by ChatGPT and all the AI methods, even like scans, MRI scans, CT scans, and so on. So the new AI, they can read these images. So the patient, if he do his research before, he come already, he know what he have and what is a better solution to him or treatment, let's say. So do you see this AI, we can trust it, and how you feel it in your daily work?
Well, it doesn't matter what I feel. AI is a reality, and it's going to evolve no matter what we say about it, okay? Because the science is unstoppable. and there is a huge demand for artificial intelligence. It has already become part of our everyday life, and I think it will, with every passing day, it will be more and more. And I actually encourage people to use artificial intelligence. There are various platforms available, but the truth is the AI is a very good filtration tool. It filters out, it sifts information available on internet or in digital media and gives you somehow the review that would you otherwise, without AI, you should visit many sites, read lots of books or lots of articles, and then you come to conclusion. AI basically sifts through this information and gives you a good resume specifically designed for you. And in some cases, the way that the AI presents information to you is also important because it customizes the presentation for you. So it does not give the information to me in the same way that it gives the information to you, although the content might be the same. So it speaks on a language that it thinks will be most beneficial for you. So I actually encourage AI. We're gonna see AI coming and becoming a part of a clinical medicine. I think the radiology and the pathology are two branches that are going to be affected by artificial intelligence the most in the years coming. As much as I know, the ChatGPT has been able to pass American Board of Radiology examination, which is a quite high standard for that specialty. So it will become part of the medicine and our everyday life, whether we want it or don't. Will it replace doctors? I am not sure that it will replace most doctors, particularly surgeons, in a foreseeable future. Eventually it may evolve so it will be able to execute surgery, because when it comes to surgery is basically a number of steps that should be executed in a particular case, and it works like an algorithm. So you have number of steps that should be executed in a particular sequence. Obviously there is a way to adapt. There is some degree of flexibility. You may want to do the case in this way or this way, customize the case to the patient, but in most cases it's kind of a standard procedure that is executed more or less in the same way on every individual, with small variations. That could be, by the way, programmed. So, but it's not going to be in a foreseeable future. It may be in a remote future. In the foreseeable future, I think AI will be a very good ancillary test for doctors and a very good research tool, very powerful research tool for the patients.
Okay, doctor, and what do you think about the examination when the patient come with all this information which AI give it to it, and you have other opinion about the case? How it will be hard to convince or to educate the patient that it's wrong or misleading from AI. Do you see something like that in the future? How you feel it?
Well, medical examination, particularly physical examination or a physical examination plus neurological examinations that we take in a case of neurosurgery, is unfortunately lost art. Prior generation of physicians were not using machines and lab tests as much as we use today to diagnose and treat the patients. And that's why they were much better examiners than we are today. In a usual scenario, when you go to doctor, you enter the doctor's office, you sit, and you tell the doctor about your symptoms, about what brought you to the office. And it may take 5 or 10 minutes. And then the doctor may or may not examine you, which will take a very short time. And then he or she will request some tests. There can be blood tests, there could be MRI or the radiological tests, or the whole spectrum of tests. And from there on, when you come to doctor's office, the doctor is going just look at the computer or to look at your paper test results. And that's unfortunate because the physical examination can give so much information that is essential to make the diagnosis. In my practice, I would say 95% of the diagnosis is made by the history, by the patient's history, and by physical examination. Not radiology, not the tests, not the tests. But it's a lost art, and we've lost it. We've lost this art when medicine became institutionalized. So the way the audience should understand that the way we practice medicine today is quite different from the way the medicine was practiced before. We think that the medicine was executed in this way because we just accustomed to it, but it is not. In old days, the doctors had full control. The doctors were not employees of the institutions, hospitals, by the way. So when a doctor is an employee of the institution, let's say a hospital, then the hospital has authority over the doctor, and usually the hospital interferes. That does not necessarily benefit the patients. So the hospital's goal may not be in line with the patient's goal. So the hospital goal is to squeeze out as much as it can be squeezed out from a doctor rather than to care for the quality. And in some cases, and in most cases, particularly in this country, I see that significantly downgrades the quality of medical care, and that shortens the time of interaction with the patient and overall degrades the level of the diagnostic capability of a doctor. And it's actually put the doctors in a position where they just basically some kind of operators. They just sit at their chairs, and the patients come in. They just, they request a test and then write a standardized treatment for everybody. It's not an art anymore. It's not customizable anymore. They just have this
So
presets.
it's like a protocol you need to achieve. Oh.
That's it. So they don't listen to patients, okay? Whatever the patient says that is outside the frame is ignored. That's very sad, but it's a reality. When you come to doctor, when you explain your symptoms and you want him or her to examine you to get full picture, But if the picture is already there, if the doctor has a particular frame to put you in, and he thinks that you belong to this frame, he will take whatever you say and put in that frame that fits. Whatever you say that does not fit to that particular frame is ignored. And that's why we see so many misdiagnoses and so many mistreatments.
That's really sad. It's also like different from country to country. We see like healthcare in country A, it's different from country B. Do you think this system or protocol, it will be also to protect the patient, as they claim, for example, like it's for the patient secure? They put this in system and to watch every step what the doctor do also.
I think the situation is gonna get worse. It's gonna get worse probably to the stage when the whole thing will collapse and a new formula or new system should be created. Because now we have layers and layers in this whole healthcare sector. So first of all, putting a healthcare in a scale of a sector, it's deeply dehumanizing and deeply unethical. So sector is specific area of economy with a specific goal to make the profit. Human health should not be the sectorized, should not be economized. Okay, the doctors may choose to charge for their treatments, and that's okay, but it should not become a sector, because the moment when it becomes institutionalized and sectorized, let's say, then the objective of any sector is not to benefit the patients, is to put them in a perpetual need for their products and services. Okay, so, and that's really what's going on today, because now this healthcare sector is not engaging in providing permanent relief or permanent treatment for the most conditions. They just do something to keep the patients engaged as long as it can be, or preferably, forever, or as long that the patient lives, because they can extract the sources and then can increase their benefits. And that happened because we doctors became institutionalized. We just the doctors need to take it back. The doctors needs to fight back and take their profession or their goal back from the institutions, and they say, no, we don't want to be this cogwheel in this dehumanizing machine.
So, doctor, all these topics, it's look like attractive topics or hot topic. So, if you have something to replace it or change it in this system, what it would be?
God, that's a question that I wish I knew how we came here. Okay, and I think it has to do with our nature, with our human nature. The way it works, the way this medical field works, it works with every other branch of our life. So nowadays, in most countries, the medical field or the medical sector consists of the hospitals and the doctors being the employees of the hospitals. There might be very few, independent doctors, and there are insurance companies, or the government may provide the insurance. And I think it started mostly with insurance. And I think that's the main evil part of the system. Because the moment when somebody tells you that we're going to give you an insurance, a medical insurance, to cover your medical treatment in case when you need it, but you have to pay for us, that may sound attractive, but it creates a very unhealthy environment. So because you're paying a medical insurance, because that's money that's not in your pocket, not in your possession, it's quite different from the money you would otherwise put aside just to cover your medical expenses when you need it.
But also it's unfair because some people, they don't have that money to put insurance or health insurance.
That's right. But let's say you have some income and you can dedicate some of your income. So there are two ways, whether you do it yourself or whether you give it to insurance company. And in Turkey, for the most part, it's kind of mandatory. So they just take certain percent of your income and put in a government insurance. And you don't have control over that. You just may use it when you're sick. So, and that creates a very interesting psychological situation, because you know that you've paid, but you don't have the control of those money. So it creates an internal desire to go and spend those money because you think that you're entitled to. That's kind of your right. I worked, they took money out of my income and they put it. So when I feel sick or barely sick, I would just go to hospital and use it because I can. So that creates a situation when people overuse it or abuse it. And that's from the patient standpoint. Let's say from the doctor's standpoint.
I pay for it, I must use it.
I pay for it and I must use it. Okay.
If I need it or no.
If I need it, no. Okay. So that's it. Because that's basically, if you don't use it, it creates a situation, in your brain, in your mind, that you're being cheated. You paid for it, and someone else benefited from it, not you, not your family. Okay, that's from the patient's perspective. So the patients tend to overuse it. And then doctors or the healthcare providers also overuse it because they know the patients don't pay themselves for it. Okay, it's an insurance company, doesn't matter, it's a state-owned insurance company, or is it a private insurance company? Insurance company is paying for them. So they tend to overuse it, okay? And what it creates a perpetual cycle when the costs of the medical services go up, they just round up, which leads to increased cuts from the patients or from the people's income to compensate for it. And it's unsustainable, and there is so much waste in this system.
Waste of sources,
waste of money, waste of sources. Things can be done at the very low cost without, wasting, but it creates a whole culture, and that no one is actually asking questions. We just overuse it. And that's the main problem. And I think it started with insurance.
Thank you so much. Thank you for this episode, and we will meet again in other episode.
Thank you, Bassam. It was a pleasure being with you today.